what advice can you give people going into the health tech space where you're directly dealing with patients? What advice could you give people?
Well, the key thing is twofold. One is we're dealing with patients, but with our clients, whether it's the VA or health, whatever health system it is, we're creating that bridge on their behalf. It's that last mile communications, that approach. And so we're still providing them the insights and the care that they got from the provider, but we're creating that bridge to allow that deeper communication insights. And so in terms of data collection, it's first of all a comfort to share the data on the patient side because that's a lot of data. It's very personal. So you want to create an environment where they feel comfortable, and at the same time you're satisfying. And so, as I said, let them use whatever device they want, communicate however they want to do it. So you've dealt with that barrier. But now you're dealing with a whole wealth of information that's being collected, and you also have to make so you deal with ease of use. But then the other side is security and privacy. So you got to deal with the security and privacy element to make sure the communications are secure and the data collected is secure, and to have again it's the comfort on both sides, comfort on the stake and the clinical side, comfort on the patient side, that information is being kept secure, and that the information they're getting is also getting to the clinician. So when they get a response, it's not a generic, oh, just make sure you exercise today. It's very specific to their personal needs. So in terms of data collection, is you want to basically tie all this together so the patient gets very specific, very personalized information and or courses of action that is helpful. The way I talk about in generalities is you don't want data, you actually want you want actionable information. And those are two very different things.
So with healthcare and this project that you're specifically mentioning, how do you put it all together? And as you just mentioned, that you have to filter out the aspects that you need from all the noise. How did you actually go about homing in on the details that you specifically need?
Well, first and foremost, it starts with the clinician because they know their patients and they know the practice or the system better than I do, or my team does. So we work with them to say, okay, what is important to you? What information do you need? And what would be the most valuable to you? So instead of seeing the patient every 3 months, if something were to occur, it basically go through a whole process, but something like occur, what do you want to know now? What do you want to know at the end of the day? What do you want to know at the end of the week? What do you want as a summary at the end of each month, for example? And we really go through that analysis with the clinician to sort of say, okay, which are their protocols. At the same time, there are a number of validated assessments out there and protocols that exist. So we do a comparative as well and working with the clinician to see what makes the most sense for them and to make sure we're using validated instruments at the same time. So the collection of data, whether it's off of a medical device or a Fitbit, or whether it's patient generated data, that's satisfying all those elements. So there's a lot of work. There's a lot of back. The thing is, there's a lot of
Yes.
background work required to get it up and running. But once it's up and running, you could scale. It's designed. You have to be able to be scalable. So that's the third prong of all this thing. It has to be scalable. So it's the contradiction of personalization and scalable.
No, definitely. And I think you're absolutely right in this. And when I work with startups or advise, I've seen numerous startups. They are trying to get into the health tech space, but they haven't talked to the patient. They haven't talked to the doctor. Or if they have, they just got a few questionnaires filled, and they are believing that that's what it is. No, in health tech, you have to get your stakeholders involved from the very beginning, and it is going to be an iterative process moving forward.
Exactly.
Also, because you really need to get to the bottom of what is needed by the patient, what is needed by the doctor, what is needed by the nurse, what is needed by the case manager in the middle, what and you really have to meet your target audience right really close, up close and personal. And it will happen that the doctor is busy or the patient is busy, has things to do. um, th- but you have to find ways to incorporate your these significant people's persons of interest into your designing, your development, your ideation phase. It has to. And as Howard has been talking about this repeatedly, I'm trying to home in on this point, that is why it's so important, especially in healthcare, to get this right. Otherwise, you may be looking for the wrong thing. You may be getting data that you actually don't need. And with all the noise and all the noise, you need to really home in on the exact things that you need. So yeah, Howard, that's great that you are repeatedly, focusing on this point. And for everybody out there who is looking to get into health tech, um, is this one of the bigger advices that you will give people?
Well, without question, fundamentally, it's, in terms of all these things in innovation, it's great to have homed in on the problem and a solution to that problem. Terrific. That's great. That's a big first step. The second one is, and you articulated very well, but is this the stakeholder or your intended client? Do they see that as a problem as well? And do they see that as a solution to that problem? And if they do, okay, you're step two on all that. Step three is, do they rank it as important as you do as a problem? Because they have, again, as you know, clinicians have so many problems they're facing with providers on a daily basis. So you may have identified the problem, but you know what? That's number five on their list. They only have time to solve one and two. So unless the problem you've identified is number one or two on the priority list, it's just not going to be addressed. You'll get a lot of pats on the head. You'll say, that's really cool, that's great, but it's a problem, but not the biggest problem I got to deal with today. So you really have to zero in on not just only the problem and affirmation that everyone agrees that's the problem, but you got to make sure that's actually a priority that has to be resolved.
Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Omar Khan. Looking forward to seeing you again. Thank you.